morning and welcome to the Capital Gang. I am Oscar Semoyamsoke with a bevy of topics, as Moses Kaule would say. These days we have television, Moses.
Oh, yeah.
So they are seeing you. That's what the guy looks like. So I usually say with a bevy of topics is from Moses, and for once, because you're on television, you can be seen.
Hello.
Hey, and I don't know. Some people call it. He doesn't look. He doesn't look like
a baby, though.
No. So I am Oscar Semoyam. So okay, we in the studio. We already have our guest, Professor Ponciano Kalebu. This is the second time we have you in the studio. You're most welcome to the Capital Gang.
Thank you very much,
Professor.
Thank you very much.
Yes, and you come at a time that is good for the Uganda Virus Institute. But let me welcome Abdul Katonto here. You're most welcome to the gang. Honorable Abdul Katonto. Great to have you back in the studio.
Thank you, Oscar, and good morning, listeners. These days, and viewers. Of
And
course.
viewers, yes.
Yeah, I have been away for a couple of weeks, but I'm good to go. I'm back home.
Yeah. There's a lot of debate on whether we should be on television or radio, and I keep telling everyone, you'd go where you want. So if you want to say good morning, listeners, it's very, very okay. And if you want to say good morning, viewers, it's also equally okay.
Yeah, I mean, it's all about our audience having a variety.
Yes,
to choose from.
Yes.
Quite a menu. There are those who like to watch, and I'm sure they can now watch NBS. There are those who want to listen.
Some people have told me that I'm handsome.
Sorry?
Because some people have said I'm handsome, having seen me on television.
Is that so?
Yes, I guess you wouldn't appreciate it.
Yeah, I might find it difficult.
So, Prof. Kalebu, Uganda Virus Institute, it's heartwarming. You're celebrating 90 years. That's correct?
Yes, that is true. We're celebrating 90 years.
Yes. And if we think about you yourself, Ponciano Kalebu, remember you're my OB, a senior.
Smack.
Yes. When you left university...
I missed it.
Okay.
When you left university, you went straight to the Uganda Virus Institute.
Yes. No, when I left, because I did medicine, I
Yes.
went to Zambia Hospital. I worked there briefly. That was the bad
Work
time.
or internship?
Internship.
Okay.
Yeah. That was the bad time of HIV. People dying. I saw patients. I couldn't do anything. I said I need to make a contribution. I decided to leave clinical medicine, pure clinical medicine, to do research. And I went to Uganda Virus Research Institute. The rest is history.
Yes. So there was a motivation in it
Very
for
much
you
so.
personally.
Very much so. Very much so. I was seeing colleagues, friends dying in the hospital, and we couldn't do anything. They were telling me, "Doctor, help me." I couldn't do anything. So I said, let me be part of the solution. And I decided to go to Uganda Virus. I knew the institute, and I talked to them, and they really welcomed me. And at that time, they really wanted young people to come. Those were the early days in the 1980s.
It's interesting. What had you qualified in? What had you qualified? In medicine, yes. What?
After your initial training, MBCHB, you're trained as a general doctor.
Yes.
Yeah, medicine, pediatric surgery, obs and gynes, and all that. And then you do internship. We used to select two options, a surgical one and a medical one. So, but in Zambia, it was such a wonderful hospital because they expose you to every discipline. You work so hard. You really worked in the Zambia hospital. You come out a real doctor.
Yeah.
Yeah.
One of these days, I'll get you back here to talk about intern doctors because you're kind of referring to it without saying it.
I was about to ask that. Were you paid at that time as interns?
Yeah, we were paid. And for Zambia, even they used to top up. So it was.
So the hospital would top up?
Yes.
Yes. Yes.
Okay. And this was in 1988?
I did my internship in 1987.
Uganda Virus Institute.
I joined 1988.
Yeah.
Yes. Yes. And I've been there since.
Yes.
Yeah.
And assistant director for all of 6 years?
Assistant director, deputy director.
Yeah.
Now director of the institute.
Since 2016.
Yes.
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 And you've steered it well, because when you hear the news that Uganda has released its last Ebola patient, it means Uganda, we are looking good.
I think we are doing well. We are doing much better than many others. It's a really joint effort. We are working together. The president from the top, the prime minister's office, the minister of health, our institutions. It's really teamwork and following the guidance, the WHO. So it's really a global, regional, national effort. So I think we're doing well.
Sometimes I think about the Heart Institute as well, where Uganda has been successful.
Yeah. The
Virus Institute, Heart Institute, yes.
Cancer Institute.
Cancer, sometimes I feel it's overwhelmed, but I guess that's not your business today to talk about the Cancer Institute.
No.
Yes.
No.
And so what would you highlight as some of your achievements? I want to spend a bit of time on Ebola, but before we go there, it would be good for you to list a few achievements. But before you do that, let's welcome Edgar Tabaro. Today you didn't have to cover for me because the roads are open. So you're most welcome to the Kaptagan Council, Edgar Tabaro.
Thank you so much, Oscar.
Yes.
I'm happy to be in the presence of Professor Kalebu. He's a legend.
Yes.
My only disappointment is that
you want to start with disappointments?
He attended St. Mary's College, Kisubi.
I was about to say, please be good.
That's a blotch on his CV, but that's a topic for another day.
I hope you know that I'm an alumnus of the same.
I'm aware. I attended Namiango College. And,
oh dear, family. Yes.
And obviously,
I like
the other
it.
legend. Pardon?
Has someone advised you on how you should dress for television? The shirt is top notch.
I'm also happy to be in the presence of my senior and former teacher, Honorable Abdu Katuntu.
We always measure Abdu Katuntu's products by yourself, your comments and all. But Prof, we are back to you.
Yes.
Yes.
So you want me to tell you the journey? What we've done?
Yeah,
briefly,
it would be good, yes.
It started in 1936, our institution. That's why this year we're celebrating 90 years. Yeah. Started as Yellow Fever Research Institute to study yellow fever by the Rockefeller Foundation. At that time, yellow fever was a big problem. People were dying, including the Latin America, US, West Africa it started. And there was really a need to understand. And one of the questions was yellow fever in East Africa, and could it also spread to the Indian subcontinent? So they wanted to come to East Africa to study yellow fever. They had many options, but they came to Uganda, and then they thought Uganda.
And did we have yellow fever at the time?
To study. I'll tell you the story.
Yeah.
And then discussions were held. Those were the colonial days. Actually, the decision was made in London in 1935 to host the Rockefeller Foundation. And 1936, they came, they met the governor, Sam Mitchell, and he offered them a site at Entebbe, which was at that time dealing with trypanosomiasis. The building still exists.
Every now and then you explain what that is.
Yes.
Trypanosomiasis.
Sleeping sickness.
Right.
Yeah. So they like it.
And what you say sleeping sickness, and you're looking at
I'm also looking at you because particularly Iganga.
Greater Iganga.
Yeah. So let me move quickly with the story, because it's a very interesting story. And somebody has written a PhD, an American, on the Uganda Virus Research Institute. In 1936, they started working on yellow fever, and they found yellow fever existed because they looked at antibodies in humans and monkeys, especially in the western Bwamba region. Very soon, they discovered a virus in the mosquitoes. And within a short time, there was an outbreak in Sudan, whereby 1,500 people died. And this was the center testing. Soon after, they really realized yellow fever did exist in East Africa, and there were other outbreaks. But what has never happened, yellow fever has never been in India. Yet the vectors do exist. So they also describe the vectors. Which vectors? And this work was done in Entebbe. The mosquitoes responsible for transmission. There are 2 cycles of yellow fever in the forest, among the monkeys, and then in the humans. All that was done. And in the process, they discovered many other viruses that are internationally known. West Nile virus, Zika virus, Semlink forest virus. They have local names, mango virus, Lunya virus. About 40 new viruses were discovered using very interesting technology. Yeah, for us who have studied virology and immunology,
Yes.
but still stands up to now. With the time, they moved into other viruses, and very interesting, the measles and polio in the 1960s, even including understanding how long immunity lasts when somebody gets infected or when somebody gets vaccinated. For yellow fever, those were the recommendations, that you get vaccinated once in 10 years. All these studies were done in Entebbe.
Yeah.
We come afterwards.
And it's still, that's the protocol still, once in 10 years.
Now they're changing. I think we think it could be
once in your lifetime.
Yeah, a lifetime. But all these studies were done in Entebbe. And it was a big center. At one time in the 1940s, it was the distribution center for yellow fever vaccines in Africa. Yeah. And expanded. We had a lot of international staff and East Africa. In 1950, it became the East African Virus Research Institute. There was the East African High Commission. So it was the East African Virus Institute until 1977, when the East African Community, of course, broke, and it became the Uganda Virus Research Institute. Over years, doing a lot of work, understanding the viruses, how viruses are transmitted, what are the vectors. In fact, we have 2 mosquitoes named after Ugandans. One is named after one of our doctors called Dr. Mukwaya. And another one, there was a gentleman, a technician called Giovanni Senkubuge. He has a mosquito named after him because of the work that was done.
I hope it's seen as a compliment
It is
to be named after a mosquito.
How about the Baviha Sese? Sese fly? Baviha?
It could be. It's possible. Yeah, it's possible. And then, of course, later, let me bring you to the challenging times were the 70s and 80s, as everyone knows. But then in the 80s, with the stability and HIV, really the institute, in fact, in the 70s, we lost some scientists left, 70s, 80s, and we lost some specimens. Not much was done. But 80s, HIV, we became a reference lab. We collaborated with many partners, the MRSU you hear about, CDC, IAVI, and the rest. There are things that we take for granted now that were not clear at that time. How HIV is transmitted. Could mosquitoes transmit? And these studies were done in Entebbe with our colleagues in our fields in Chamliwa, Masaka, everywhere, to tell you which are the risk factors for HIV. We have done a lot in treatment, prevention of HIV, but also uniquely understanding the virus, because we are virologists, immunologists who understand the virus, to study how the virus evolves, how the immune response responds to infections, so that later you can have interventions. Studying the pathogenesis of HIV. So for HIV, we have done quite a lot, including vaccine studies, trials, understanding the viruses. Now we come to the time when viruses became a threat to humans. Now we talk about emerging and emerging infections. We're there, very well prepared. You heard us when COVID came. We were the first to test, to tell you that we have COVID. We have detected many viruses. On count, we have about 145 new outbreaks that the Institute has detected. Some of them have been small, 1 or 2 cases, Rift Valley fever here and there, Crimean Congo here and there, but they are bigger ones. Bundibugyo, first discovered, and with our scientists and the US scientists, and named it Bundibugyo virus. First did the work in 2007. And we are not only doing it for Uganda, we have regional labs. We have regional labs that support the region, WHO labs. So we are an international lab. And now we are coming to we're talking about threats, the future. I think people say The human race will go, but the last to remain will be the microorganisms to completely destroy you. But also the threat, one of the biggest threats moving forward could be viruses. So we have to be on the lookout. So we do research, we do outbreak responses. We're a public health lab working within the Ministry of Health to ensure that we're everywhere. We have labs in Arua. Now they are working very much with the colleagues in DRC, our labs in Arua testing. We have field sites. We have those working in Chamliba and Masaka and elsewhere to be on the ground working with the Ministry of Health to detect viruses, understanding the viruses, how do we intervene. So that is what we are. And we are happy to celebrate because, shall I talk about the celebrations later?
Yes, it'll be a little bit later.
Okay.
Good point, good time to welcome the Minister, Honorable Lydia Wanyoto Mutende. You're most welcome to Gang.
Morning, Oscars, colleagues at the Gang, to our listeners
the only
and the
minister
viewers.
who's still on Gang. And Derek
I'm a
Wandera.
Gang first before others come.
Yeah, we are going to give you leave so that you do government work.
On Saturday.
But yes, Derek Wandera is in the studio. Most welcome to the studio, Mr. Derek Wandera.
Thank you, Oscar.
Yes.
Always a pleasure to be
I
here.
take it you're still unemployed?
Very, very unemployed. Please employ me.
Yeah, we might send you to the Virus Institute.
I have been there with the professor, and
yes.
we did some good work during the COVID time.
Okay. So, Prof, just from you, before we have comments around the table, I remember a long time ago when I interviewed you on television, I asked you about the turnover of doctors. And you being an inspirational director at UVRI right now, do you have young people, young persons coming in with such aspirations? And are you able to absorb them? Because there's been this battle with interns and then a battle with doctors leaving. I don't know. Because at the time you told me that there's not a lot Uganda could do because we're churning out so many doctors.
That's important because in some countries they regulate the number of doctors you train.
Yeah.
Because of that absorption.
Yeah.
So you don't just train. Otherwise, you become doctors will go on the street to sell mangoes. Yeah, right. So you have to be very careful. In London, in UK, they regulate. You don't just increase number of medical schools or doctors. You have to be of course, here we have that pressure. Yeah, doctor ratio, doctor-patient ratio. But you have to be very careful to keep the standard.
Because even though we have many doctors, we've not met the doctor-patient ratio.
Yeah, but that we should not only aim at numbers.
The scale.
We should also aim to maintain the quality that we have. So they have to be mixed. So if you have so many medical schools coming up, you have to be very, very careful. But as an institution, we don't hire mostly clinicians, but I can say we want to hire scientists. Of course, now the drive is up.
Well, what's the difference between the clinician and the scientist? I did say that every now and then, say things in English.
Because for a clinician is part of science. Right. But in science, we have many. People doing zoology, botany, people doing animal work. We have a mix of all these at the Uganda Virus Research Institute. Now, the other problem we're encouraging students to study science. And there is a danger also, because if many go to science, how are you absorbing them?
Yeah.
So you have also to be careful. So I'm very proud to say we're one of those who are really recruiting and employing scientists. At the moment, we have about 800 staff. And mind you, only about 80 are government staff. The rest are on project that are funded externally mostly, written by our scientists. Yeah, write a proposal, you get funding from Europe, NIH and the rest, and you employ these scientists. Many have done well, and even they go into other institutions, WHO and the rest. So we can say we are proud, we are good employers, and we are helping to employ the scientists. So that is one of our major mission, capacity building and training. We have many, we train masters, interns. Every year we get about 100 interns coming from different universities. We offer opportunities for master's project, PhD project, and postdoc projects. Our staff are lecturers, they're professors in different universities, and one of the future goals, we want to become an affiliate of Makerere University. We've chosen affiliation because we retain our independence, but we can offer master's degrees PhD degrees of Makerere University.
Yeah.
So it's a very, very important part of our capacity.
Okay, and finally, what are the celebrations? What are you planning to do over? Is it a week-long celebration?
90 years. We said we didn't celebrate 50 years. We didn't celebrate 75. We have to celebrate the 90. If we wait for 100, we will not be there. So I said, let's do this 90 years. A good time. We have started activities.
100 is just 10 years from now.
But I'll be in
Where
the village.
are you worried?
I'll be in the village.
They'll call you back.
She's the Minister for Public Service. She's saying she returns your contract.
I want to be there. And the colleagues are excited. If you see the excitement at our institute about it, even internationally, unfortunately, we had so many guests who were planning to come. But what you see, Ebola, many of them have said no. But all the same. So yesterday we had a tree planting day. And one of the reasons was, when you look at our institute, you look at the pictures of 90 years ago, you see the trees that we have up to now. So they're 100 years. Our forefathers, earlier generation, planted those trees. And we said, why can't we do the same? Plant some trees for a healthier life, so that 100 years people can see. So yesterday it was a very wonderful day. We had the Member of Parliament from Entebbe as chief guest. We planted the hard trees, the mosses, the mahoganies, and others. We told people, take home 90 trees at 90. So yesterday we started. On Tuesday we have a science day. We have invited very good scientists to talk about the epidemics, the viruses, immune responses, vaccine development, vaccine hesitancy, funding issues. So we're going to have international participants and local participants on 21st at Entebbe giving these scientific presentations. Posters, people will see what we do. Exhibits, people will come and see what we will do. We expect for the Science Day, about 500 guests who will be with us.
That's big.
On the 22nd, that's the main celebrations, we are going to have one thing. We're going to open a new lab, a regional lab that is going to do genotyping of polio viruses. We are looking at the end of polio. Now we are very careful to sequence the polio. Is it the live virus or is it vaccine-related virus? So we are opening a new polio lab, and we have a delegation of WHO team that are coming. We are also going to have UVRI launched as the East African Center of Excellency in the region. East Africa has created centers of excellency. Cancer Institute is one of those. In Uganda, UVRI will be the second to be a center of excellency for East Africa. Muhimbili is a center of excellency for non-communicable diseases. In Kenya, Kenyatta University is the regional center for other diseases. So we're very proud. We have a delegation coming from East African community to be with us as we are launched. We had invited the president. He has sent the Right Honorable Prime Minister, who will be the chief guest, but we have other guests, ambassadors who will be there. We are going to have a message from the Director General from WHO, Tedros. He couldn't come, but we have a message from him. So it's going to be an exciting day to really speeches, open a launch, see what we do, and enjoy the day.
Fantastic.
We are coming out with a very good magazine. I hope the New Vision can give it to me today, describing our history.
Mandela is on in the monitor.
So we have a magazine that is, I'll give you a copy when it's out, to see our history, where we have come from in the 90 years. So that is what we're doing.
Yes, and I shall visit the institute.
Most
welcome. Heartwarming stories, Honorable Abdu Katonto. Heartwarming stories on the achievements of the Uganda Virus Institute. I think if an institution is 90 years old in Uganda, that's already an achievement on its own.
Yes, and it's one of those rare stories of success in our country. The longevity, and then when you see the trajectory. I grew up in Entebbe myself, and I do remember when you're walking through Runyo to Nachiwogo to pick a little bit of fresh vegetables and fish, learning I passed the institute and so on.
It's tarmacked now, by the way.
Oh, yeah.
Yes, it is.
Though it has always been tarmacked, but over time, it was tarmac and not tarmac.
They are working on it now. They are real working.
And so on. But you also look at their history. Yes, this was a colonial institute, as he says, but later on the East African community had an agenda, and they established some of these institutions which were supposed to, you pull resources together as a region or the countries and develop them. For example, the civil aviation, we had the Sorority Flying School. That was also a regional institute, but for the entire community. So is the virus research. And as we talk now, when you're talking about issues of virology, I mean, you're talking about a center of excellence. They've really moved, and Professor here, I think he knows nothing other than that institute. He doesn't remember addressing, I'm sure, touching a patient in Zambia. He's been that place all these years and so on. So these are people, I think, some of the heroes and this country has. It's when we are faced with a problem. For example, when we had the COVID, that's when people started running around and so, by the way, what can these people do? It also goes back to the policymakers. When do we get the resources to invest in institutes like that? Sometimes issues of research, you don't see results now. But Ugandans are such that they think to put money there should be a bus for you to see, there should something visible for you to see. Countries that have developed and those whom we run for help have invested positively. And you need to invest in institutes like this. There are things, Oscar and colleagues on the gang today, you don't have to run to Europe. These are professionals. You've got professors here who are in this sector. They have put up whatever they can, the best of themselves in research and so on. They could be as best as anybody at the CDC, for example. Whether I don't know whether the continental CDCs all that talk about, but really when you're talking about the US and all these other in Atlanta, all these, it's because they have invested. So really, for the policymakers, institute like this, we need to put their money. But you can see how many on the payroll this big is.
Just 80.
80. 1, 2, 20, 30, 80. 10%. So we now must rely on other people who know what they want. And they are ready to train. They are ready to put their money. And eventually they pick those people they have trained, or even the research, and they take it for their use. For us, this lady who gave birth to us, sometimes I don't know what was wrong with her. She didn't give us what we should be having, because we have some resources which we can invest, and that research institute can even grow big and big. We can't always continue to look for somebody in New York, in Norway, because China, they are now like, okay, what do we do? What do we do? So why don't we? Because one, it will be cheaper to train that scientist in Kampala or in Entebbe than training him in Atlanta, in Georgia. So they put here, and eventually they pick their research. They benefit from our own resources, but they'll put their resources. And for us, we can also do it. And we have all these younger people who are very innovative, whom we can invest in. But the Uganda Virus Research Institute is one of those cases of success in this country and in the region.
Well, in the region, Edgar Tabaro, they've done well, but they have a good story, but we've been annoyed with them as well. We have not been able to travel because of alarmist messages from them. Alarmist messages from
alarmist. But
about Ebola.
I was watching,
and yet we've had only two people. Well, sadly, 2 people have died, and they've kind of not been Ugandan population. So could they have done better in handling?
By the way, they put us on some sort of list from Washington.
Level 4, but that's a bit different.
That's a bit different. It's about security. And all the other countries are at war, except for Uganda.
Yeah.
But well, that's for the leaders of this world to manage. But we need to put the Honorable Kasolo Haruna on the... We should put him on the news so that he explains to us, explains in Parliament how Uganda can be it's a level 4 alert for US citizens. Anyways, I and Honorable Katunta trained to study body language in court. I was watching Professor speak, talking about the years of challenges and progress. And you would see a man who is satisfied.
Passion also.
You leave the passion, the satisfaction, the smile, the gestures you are throwing, and really, I must add, it was infectious. Many scientists tend to be abstract,
Yes.
But Professor Caleb was ably, presented his case, and there's a reason why I'm also laughing. My interaction with the Uganda Virus Institute goes a bit, maybe slightly over a decade ago, when a person I know, a person I'm acquainted to, Dr. Emmanuel Katongo Lembide, unfortunately, who is also the OB of SMARC. I don't know. Yes, I know what I'm talking about. When he was first posted there as a director from Uganda Cancer Institute. And I watched the trajectory. Yeah. And up the time when you took over, I mean, it became stiff, the vertical and horizontal expansion, and fairly, quite admirable. And you remember the responses from the ministry whenever we got the Ebola attacks, they were quick, fast, and furious. As Honorable Katutu says, he says rare, but there could be other success stories that have survived over the years. But maybe today is the Uganda Virus Institute, and we thank you for that. But the most important things to pick from this are that despite the brain drain that Uganda suffered in 1970s, remember immediately after the 1972 failed invasion by some fellows some are now in charge, others were overthrown over the years, but there was a brain drain. Many of the Ugandan doctors went to Kenya, relocated to Kenya. There was another brain drain immediately after 1979. No, the ones of South Africa went after 1980. Not 70s.
Those are our time.
Yeah, that's yes, up to around 19. And when you go to many of these institutions in South Africa, you find names like ours, like ours or Uma. His fellows from Palisa, Mungerera. You find those experts running those institutions. So, in spite of that brain drain, we've had the Kalebos who remained, who chose to stay and run the show, and today we are giving them the accolades. CDC really rates Uganda Virus Institute very highly, and that's the reason why they're pouring funding there. Now, the disjuncture.
Sorry, what's CDC?
Centers for Disease Control.
Right.
Now, the disjuncture is the internal domestic funding vis-a-vis international funding or external funding. Now, when funding comes from external sources, they may even dictate the what?
It comes with the conditions, of course.
Conditions, but more importantly, the agenda. They set the agenda, and the agenda may not necessarily be in the interest of what. Now that comes to what we are talking about, that the alarmist messages. I don't think the messages were really alarmist, because when you have a disease like this, but now on this occasion, the death rates have not been as high as they were in the past.
That's in Uganda.
Yes. Don't talk about Congo. Congo is a very. I think we should go and take fully charge at the expense of sounding like I'm undermining sovereignty of another country.
At the expense of sounding like the American president.
I wouldn't want to be like him, but I think we should go and take really charge of affairs in that part of the country, insofar as things like disease control, research, and what have you, because we've seen we are host to many of those communities, and particularly when there's instability, they come this way. There's very close interaction between the border, the border districts, trade, and what have you. So it's important that we do take charge of some of those activities in those countries, because first of all, they lack the capacity. Two, even if they were to build capacity, it will take years for them to build that capacity. So when it comes to the other challenge we have is that, yes, in as far as fighting epidemics in Uganda is concerned, we've earned accolades internationally. But why is that disjuncture? Why is that disjuncture in terms of service delivery of whatever health services? Why is it?
Why is it that UVRI can work very well?
Yes.
But Entebbe Great Bay Hospital,
which is just
next door,
maybe 1 kilometer away.
Less than 1 kilometer.
Less than 1 kilometer away. Just the next, probably the next road. Why is that disjuncture? Why can't the same be replicated? Is it that maybe these ones have a different gene pool from these others? I think that's all. It comes to the issue of governance. The issue of governance. Uganda Virus Institute has been permitted some autonomy, and that's why you see them attracting even all these international experts, either coming here to do their field research or collaborative research with our people.
What is their budget, by the way?
He will answer.
Budget. When you look, now I have to be
from the national coffers.
From the national coffers.
Yeah, from the national.
Let me tell you a history a little bit, and to tell you when we became a vote in 2017. Before we were a subvention, Minister of Health, and we were getting money barely to pay salaries, 1 billion. But when we got subvention and we were able to go to finance, the funding started increasing. 6 billion, 7 billion. The highest was about 15 billion, but now it has come down to about 7 billion. And we can say, if you take all the work that we do, the contribution of government at that time, earlier on, was about 2.5%. Now maybe the contribution is about 10, 11%. If you take everything. But when you go, because here I'm including some of our international partners, we are working together, the MRC and the rest, where there is also funding. But if you look at my budget as director, Uganda Virus Research Institute, of course now the government funding has increased, especially after COVID and all that, and it comprises about 33% of the entire budget. Yeah. About 30%.
Now, the shocker, Bwana Musomesa,
70%. Somebody is picking our bill. 70%.
And much of it is actually, I think, for salaries.
No. The research.
From the government.
Oh,
of Uganda.
from government.
Government of Uganda, just salaries.
A lot of salaries.
And operations.
And the reason I would love to get government funding, especially if you get development funding, it can help you on the infrastructure retooling and all that, which external funding will not do. I mentioned the East African community. When they broke, they were building many houses in the institute. They all stalled. We could not do anything for years. Until recently, when we managed to get some development funds, we have renovated houses. We have done some good work on that infrastructure. It does help. If we can have government funding, infrastructure and all that, because with that, you can attract external funding for research and all that, and other funding. So we need money for research, but also infrastructure is so key to us.
Actually, when you look at those residences as you move along that,
red bricks,
dilapidated pieces.
But now you come.
No, it's changed. It's changed. There's a bit of sprucing up.
It has changed. And we are proud. We have 70 acres. We protect. We didn't go for this structured adjusted program of the World Bank, selling houses. People fought. They said we should sell houses. But Dr. Mbide and others, predecessors, ourselves, we really worked to retain.
I remember the fights. I remember the fights where the undermining IGG. I remember. They even went and photographed your banana plantations, the village.
We suffered. They really took us everywhere because they wanted the houses and the land.
Of course. Having a vision. Just close out, yes.
The shocker is that, and I'm really disappointed on this, Professor, not really passing the blame on you, is that up to now, Uganda Virus Institute is not affiliated to Makerere University Medical. I mean, this is Honorable Wanyoto. I think this is what you should take up at
is there a plan? And
no. I mean, to quicken it, because that way they can also benefit from research funding from Makerere University, and importantly also attract staff, the academic, they'll have collaborative programs between their researchers and Makerere University, and also importantly getting their researchers and their publications to be recognized and become academic staff of Makerere University. So, Honorable Lydia,
I take the directive.
It's not a directive, it's Lydia. She's my student. So, it's a request. Please take it up with the cabinet and quicken the process. Don't leave it entirely on.
Does that mean that?
Okay,
does that mean that your student doesn't have to speak when you speak?
Honorable Lydia,
I wanted to comment on, which is very important, the way people left. In the celebrations, we are bringing our seniors, the old people, and one of them is Dr. Peter Tukey. He was the second African director. He was the second African director. Like the first African director, Dr. Kafuko, passed away, but Dr. Tukey is still living, and we're bringing all of them together. When he left in 1973, when there was instability, he went to Kenya, and he's one of those who started the KEMRI in Kenya.
Yes.
Yeah.
Can you imagine?
Yes.
Yeah.
So
1972, that brain really hit us very badly.
We are going to be with them all, celebrate together. Very yesterday we had one of the most senior living. He celebrated 91 years. He joined in 1957. So you were with him yesterday.
Honorable Lydia Wanyoto on microphone, celebrating Uganda Virus Institute.
I celebrate Uganda Virus Institute for the great work done over the years. 100 years, 90 years is worth celebrating. Even just 1 year is worth celebrating. But that you've done 90 years is good. It's a big contribution to our country's involvement and development in the science sector. Everybody knows that the government has pronounced itself on sciences. We may not be doing it the way many people like, but that shows that there is an interest even of enhancing and motivating science-driven program and agenda in our country. And you cannot talk about science and research without areas that are so technical, like researching on virus and building understanding of science in the virus sector. We have suffered virus problems in the country. It's a specialized area. We hope that we can also support it and enhance not only the area but resources. When I was in the East African Parliament, Virus Research Institute and other research institutes that are of virus nature were high on the agenda. And I remember we visited Entebbe as one of them. There is one in Kenya, I think in Kilifi around Mombasa.
Kilifi.
So, and then also in Tanzania. So I think that even as we look at ours, that is 90 years, we could also up the agenda to make it look regional, because these viruses sometimes are cross-border and they can be a menace when one side of their border is not managing and for you here you are managing. So sometimes it's good to have it cross-border so that there is a joint effort, not only on building capabilities but also resource mobilization and managing in terms of securing the population mainly, but also livestock. So that's what I can say about this. I think it's good. And this marking of 90 years, you are calling it celebration, is a good sign, a waking call to position this important area to policy makers' attention. So I'm happy that you invited your area MP to do one of the activities, but coming to radio and TV, but also now that Monday is Cabinet Day, I really hope that our line minister can mention it in the cabinet. I'm going to draw it to his attention. That's not, I'll do it the right way protocol. If you can give me a brief write-up. We sit in Entebbe, you see?
Yes.
So we can actually pass by after cabinet or before cabinet so that we can visit and see how much we can give it the attention it deserves at the highest level. So that's what I can commit, and public service is available to support, but our line ministry will take lead. I will make sure that the minister makes mention.
And the Makerere affiliation?
For Makerere affiliation, I will do the same. The line ministry for Makerere is Ministry of Education and Sports. And fortunately, I sit next to Dr. Miengo. So even that on Mondays, it's possible that I can raise it with him. He comes early, but I also try to come earlier so that I talk to him before cabinet starts. I have not beaten him on time management. Whenever I think I'm early, I find him seated. So I'll be able to also draw that to his attention. And I think if you can give me your business card, I think you are good to go. I'll be able to do that. Thank you so much.
Thank you so much.
I'm doing my public service work.
There's all this feel good, but we need to task Professor Kalebu here on those Ebola messages that have closed out Uganda from travel. Ugandans could not go to the Americas, Canada. Dubai is still closed to Uganda.
Yes.
And yet Uganda has not been heavily affected, and Uganda needs to be applauded for our work with Ebola.
I think when it comes to fighting virus in this country, in Uganda, is one of those areas you will find a lot of praise to the government, but also to institutes such as Uganda Virus Research Institute. I met Professor Kalebu during COVID, and I think it had just broken out. Maybe we were 2 days into our lockdown. It is the most expensive trip I've ever taken to Entebbe, because I used Uber, and I paid 120 going and 120 coming back, 240. But when
were you an essential staff?
I was certainly
essential staff.
Certainly, I was essential. So I met with Professor and I did a very deep interview. And one of the shocking bit of what he told me, and something that caught my eye, was how he was suggesting that the virus be fought. Let at least 70 or 80% of the population get it. Let those who are weak die. The strong ones will live and get herd immunity. And I was like, wow. So I took the story to my editor.
What was wow?
You are like a shock.
Yeah, I was shocked because the number of people who were dying across board. I took this story to the editor, and the editor didn't run that.
People dying here or in Europe? Europe was
in Europe, yes, worldwide. Not here.
But here we are.
No, we were good. We were containing it, and that's what Professor was saying. We need herd immunity, because when it comes back to, the next time,
the next wave,
it will not affect us. So talking about virus in this country.
I don't know whether he quoted me well.
Professor was saying people should die so that those who remain remain immunity.
No, it was controversial. I actually discussed it with the editor, and editor was not very comfortable.
We got some misunderstanding somewhere.
Maybe.
You make the correction.
Yeah.
That's why the editor didn't run the story.
The herd immunity is what caught my eye. But what I find so fascinating is that this institute has been here. I think if there is anything to celebrate about this country, it's about Uganda Virus Research Institute, because when it comes to containing many of these outbreaks, it has been top notch. And you can see, I wouldn't even call them alarmist messages, but I think it's the alertness with which government uses, especially when it comes to such times. The alertness and just the fear of if it hit us hard. Up to now, President Museveni still wears a mask, and one wonders whether, it's just about the alertness. And I give it to Professor, very, very astute. And again, I think the whole country should join hands to celebrate Uganda Virus Research Institute on their 90 years. And I know that they've trained many researchers who, even when Professor is not here in 10 years, like he said, maybe when he's in his village, we will have people who will still run the institute. Yeah.
But coming back to you, Prof, the medical world, the health world, make these alarmist statements because of funding. And when the UN, when Dr. Tedros was asked, he said, well, when we make the alarm call, we get more funding, and actually we need a lot more funding. But here in Uganda, we perhaps looked at it negatively, and we're saying, you shouldn't have been saying all these things because we wouldn't be banned from everywhere.
Yeah. I think all of us were not happy. We were not happy the way WHO.
Yes, just go to the microphone.
Yeah. I think we were not happy the way WHO handled this.
Right.
They put us together with DRC. I know when there's fire with the neighborhood, you also need to be very, very careful. And the borders are porous, as you know. But I think it was badly. It wasn't us. It wasn't the Minister of Health. It was not internally. It was outside. And I think partly, if that's what they say, you may alarm and they alert people, but it has had negative consequences for us. Because we said the problems in DRC, it's not in Uganda. So every time they were talking about DRC, they were including Uganda. Problems in DRC, Ebola, and yet we had very few cases. So we all complained. So few cases separate us. Separate us. And that did affect us. Because we have had even before a few Ebola cases, you contain them, and doesn't cause travel bans and all that. So it was, eventually I think they pulled back. If you look at the reports now, even when you Google and see WHO, they try to separate Uganda, it's not like this.
Damage had already been done.
Yeah, the damage has been done. So it was not good at all. And I know the ministry did complain and to WHO. So
and then they never celebrated, like the way we've celebrated the last patient who's been discharged. They if they'd celebrated Uganda's successes, if they'd celebrated Uganda's intervention in the DRC, because that's very big.
Yeah, it's very big. Teams have been there, and it's making a difference. Our teams are there helping in the care and all that, tests. We have mobile labs. It is helping, working together in the region.
We even sent teams to Sierra Leone. Remember when Sierra Leone was on fire? Sierra Leone.
Yeah,
you sent teams there.
Yeah, we did. Yeah, we did. We did. Yes. So I think it was not well managed. Yeah. And we hope in future things will be a little bit different. Yeah.
And perhaps that's a wake-up call.
But of course, we need to know that we are not safe if DRC is not safe. That one we need to know.
We must be vigilant.
We need to see that in Congo things stabilize, and then we'll. Because now we're counting now 42 days. But still there's a risk.
That someone could get out of. But does that mean in the medical world you need to look at PR as well?
Yes. Very important.
If you think you just go and treat someone without PR, it's a big problem.
It's very important. I know WHO has been undergoing those challenges. Withdrawal of American money and all that. We need to show we are there, we are doing something and all that. Maybe I don't want to say things I'm not sure about. I know, but I think we all recognize it wasn't handled well.
Yeah, we're about to go for a break, but we have a minute. And do you think funding will improve for the Virus Institute?
I think for me the most important thing is what Honorable Wanyota said. There's goodwill from government. There's goodwill to support science, from the president, and that is very, very good. And I'm happy they have given us the environment. Doing us. We don't have political interference. They have left.
No.
They have allowed us to work
you don't want political interference with a virus person,
which is very good, and we want to leave that legacy. We want to leave that. We are all doing our best. We are very good scientists. We want to leave very nice people. I hope when I leave, we have very good managers of the institute. We don't go back. So that goodwill is enough, is good enough to have very good.
Edgar is enjoying this.
We don't want to look into microphones too much. We look into microphones, not microscopes.
From the senior
There's a difference.
Who's requesting that I should put it to a senior person from the UPDF, collaboration between the Virus Institute and the medical services in the UPDF.
Very important. We need to do it, and we talk. We need to talk. The medical services from the PDF.
I'll give you the contact.
And in the like police, when they were setting up their forensic department, they came to us, DNA testing, how do you do DNA testing? We did help them a lot. We gave them our plans, the way we do our plans and all that. We went to Naguru here. So even with UPDF, they're very nice people. We can work together. And viruses are a security issue.
Indeed.
So
let's stop for a quick break. Please, Honorable Wanyoto, let's stop for a quick break. Welcome back from the break. It has been a loud break, and minding Derek
was loud.
Pardon?
It was only the minister who was loud.
Well, it was in the break, and Derek being cautioned to use
I was defending.
journalistic style, alarmist language. Derek, I want you on microphone, and before Professor Kalebu concludes, because you're the one who brought my attention to the Minister of Health's comments on Mbarara Hospital.
Yes, so I think
I invited him, but couldn't manage to get him.
Okay. So last week, I think it was on Wednesday night.
And Star Cafes, yeah. So
yeah.
Edgar, you could as well get into it. Thank you.
The Minister of Health, Dr. Chris Baryomunsi, made an impromptu visit to Mbarara Hospital. And the image he found there, well, was what we have been seeing in many hospitals. He found is a regional referral hospital.
Yeah,
Yes.
and actually it has a teaching component. The other side is
Yes.
teaching you school
So
there.
he found a very overpopulated hospital. Some of the patients sleeping on the verandas, some of them on the floor. Very few, actually three, I think he's quoted three medical workers. Surprisingly,
Interns.
they were interns only, and no professional doctor, qualified and stuff like that. Well, interns are also on the way of being of qualification,
Already qualified.
but there
When you're
was
an
no
intern, you're very
staff.
qualified. Yeah.
There was no staff for the hospital, and many people raised issues of, being forced to pay money which is not supposed to be paid in such government hospitals. Others buying drugs in government hospitals, being forced to buy drugs. They also raised issues of not being attended to. You go with a very heavy injury and you have to wait for hours, 72 hours, before you are attended to by any medical official. And surprisingly, the Minister of Local Government made similar impromptu visits in different referral hospitals and general hospitals across the country, and the image was similar.
The local government?
Yes.
He went to health centers, not referral hospitals.
Well, all of them.
No, they are.
He went to a health center.
Went to health centers, three moreover.
No, he's right, because yesterday he was in Mbale Referral Hospital.
He went to all.
Oh.
He went to
Yes,
all.
he did.
He went to
He
all.
went there.
All the referral
He was
hospitals.
visiting
yesterday
not
he-
all referral hospitals, but he was visiting
Where he was.
health facilities and referral hospitals, as well as general
Edgar,
hospitals.
remember
So-
last week someone commended your not heckling. So
No, I'm not tackling. We are just clarifying.
But he did.
No, we are clarifying.
These are facts these are facts I report about, so I know what I'm talking about. So the same image, the same comments, and the same concerns were raised by patients, but also the same image of not finding medical doctors in those hospitals was the same, similar to what had been seen by Dr. Chris Baryomunsi. So it's in my view something that we've been writing about, things that we've been talking about over again, and I'm happy that this cabinet is trying to move into going to witness, going to see, not to hear and receive reports from DHOs and stuff. And I know that if we move in this manner, where ministers make impromptu visits. First of all, the absenteeism in hospitals and schools is going to reduce. Probably even like medicine is going to be well distributed in these hospitals. Some of them have issues of getting medicine, and these health workers sell the medicine instead of putting it in the hospitals. So it is something that has made an entire week very busy. Those impromptu visits on schools, on hospitals, on health facilities and stuff, it's been through the entire week. And the country, a very big section of the country, is very happy, regardless of where they fall politically. Yeah.
So this is Professor Kalebu, and then we'll let you go. I wanted to start on this topic mainly because Edgar also asked, where do we have this disconnect? Like you have in the institutes, Virus Institute, things are working very well. Presumably, you may even be paying your interns. You go to the Heart Institute and it's happening, but in the hospital, I mean, the Heart Institute is very close to Mulago referral, and I guess we've not had complaints from Mulago referral. But where is the disconnect?
That's
in the medical world.
That's a very difficult question to answer.
And you don't want to be wrongly quoted as
when you're celebrating 90 years.
When you're celebrating 90 years. Yes.
I'm celebrating. But you need to go deeper to understand in some of these institutions what is really happening. It could be the individuals. It could be the whole system. Yeah. It could be a local problem. It could be an external problem. So we need to look at all these different issues. But I think even the culture, I think to us, we are happy that we have a culture. You come in, you have to work within our culture.
Yeah.
You destroy the culture, it becomes very, very difficult. If there is absenteeism, people are not working, they come like that, it is a bit of a problem. The culture has to change. But those culture, why things have changed, could be historical, it's long time, funding, what is the motivation and all that. So we have to look at all these different things. But for me as an institution, I think, of course, funding. I know when I joined the institute and there was hardly no money and all that, I could see. I also used to come in the morning, in the afternoon I go to the clinic, make some money to survive and all that, and it was very difficult. And things have changed over time. People are busy. You go to our institution, everyone is busy, running up and down, very busy. Yeah, we have managed to sustain it through hard work, because as I said, a lot of the funding, you have to write proposals, get them, keep that culture going. When people come, they fit into the culture. So that has really helped us.
Well, so we can let you go now.
Okay.
Thank you
but
so
I
much.
want to thank you. First of all, thank Capital Gang. I think this is a very good program. Yeah. And you have done well. People like Katuntu here, many years, Honorable here, you have done very good. Keep it up. It's very important when you come, you understand the subject, you have read, because we people who listen, you say, this guy is talking, but he's talking from ignorance. Yeah? So it's good always to come. I know there's no time to read. I'm a scientist. I like facts. I'm not a politician sometimes who
even us politicians
sometimes they feel in.
We also like facts.
Sometimes.
But we also like facts.
Yeah, but you are very good and you have done well. I thank you. I didn't want to go without thanking you. Keep it up. Oscar, you have done a good job.
Thank you.
But also
Oscar is going to pause on us.
But also on behalf of my colleagues, I've really enjoyed interacting with you. You are very supportive. Yeah, compliment you have given to our institution. I'm sure my staff who are listening, they are very, very happy. You appear to know us, and you appear to be very supportive. So thank you. Thank you very much. Thank you.
And I'm seeing the sung and unsung heroes.
Thank you.
And
thank you.
Not many guests who come here live smiling.
May you all live beyond 90 years. Thank you very much.
Thank you so much, Prof.
They need to take pictures.
Continue the work on the microscope. For us, you have the microphone.
Yeah.
The Abdul, it's a crisis because Edgar here says he wishes Professor to live another 90 years and so on. But we know someone who has said they want to live 100 years. Mm-hmm. But if a Minister of Health,
like a prof,
if a Minister of Health is saying things are dire, what can you say? And you and I have a friend who runs a hospital in Seguku. Yes. And the culture, like the way Professor Kalebu said, and the culture is entrenched. So you are assured of a good service all the time.
It's quite difficult and really painful. But today, if you go to a private facility, whether Doctors Hospital of our colleague, or you even go to Nakasero, even the private facilities within this city, as a patient, you will think you'll get out of that place when you're better.
Yeah.
Then you go to a
even
public...
from first look.
Yes. Then you go to a public facility, especially now up country. The infrastructure is horrible. 2, there is no public relations between the health workers and their patients. Even the physical looking of them, you find... You see my brother one day, the way he's dressed now, and somebody walks in and they say, this is the doctor. We never grew up that way. A doctor would come in with that white gown, sometimes with a tie, with that thing of theirs. Then the nurse is very, very clean, hygienic, and so on. And you have gone to a place where you get better. The infrastructure in many of these hospitals is very bad. You go to Iganga Hospital, and I encourage Dr. Chris Bariomusi to visit many other hospitals physically. And I agree with Lydia when she said, you don't have to wait for these DHOs to write for your reports. Up country, the situation is very, very bad. It is stinking. You go into a ward, it is really stinking, Oscar. If you have ever gone to a hospital, and people are all over the floor. And there's this young man or girl, a lady running around, she's intern. That's why we got so hard on government the other day when they were trying to say, well, they can't pay interns because we know who runs these facilities. And Dr. Chris Bariomunsi's prompt visit to Mbarara is just a testimony of what we are saying, that these hospitals, can you imagine a referral hospital? You go to it, and Oscar, you find only interns there with maybe hundreds of patients. And these are the people you say, look after yourself. Where are our senior medical officers? They are in their clinics. They are at home. And these are the boys and girls, young doctors, managing these situations. Oscar, we need a paradigm shift. I think that's what it is. We need a paradigm shift. Public service, there is a big, big problem. And you may not dislike what the vigilante of our new ministers who want to make an impact. But maybe it's because of the frustration they have found. So they must find an unorthodox way of handling the situation. Because what we all know, to divert to what you people have been talking about local governments, there has been a lot of decay at local government level. A lot. And not that the money doesn't go. The money is appropriated. But there's no work done.
That's where corruption
Yes, there's no work done. And sometimes if you say, okay, let's wait for the CID to open up a file and then blah, blah, then it takes time. They don't even have money to go and investigate and so on. So you need to achieve, okay, does Balamu's crusade achieve illegal prosecution? Maybe not. Criminal prosecution? Maybe not. But does it scare somebody? Because one, if they arrive and there is a pit latrine without a pit, but money has been paid.
A pit latrine without a pit.
But the documents show Did he say 73 million shillings? And there's a small hut there. And Oscar, these are real things. So Balaam is achieving something the unorthodox way, but don't get it wrong and imagine that will lead to prosecution. Because prosecution is a different animal. You need evidence, chain of evidence, you need witnesses, and so on. That will not. But at least for this guy to say, of course, and then it takes, with our backlog, it takes a long time. By that time, witnesses have lost interest to appear in court. So, but if engineer knows that they will come here looking for this road and it's not there, and he flees, there will be an instant when say, no, I think this is bad business, because these guys can come in time. We tried to do that some time back.
That anytime someone can walk in the ward, you better spend some time on the
Oscar, I was chairman of the local government accounts committee, and at that time I took over from my brother Ekanya. But the committee then used to sit in Kampala. Then they required these people to come and do accountability in Kampala. Can you imagine somebody comes from Kisoro with a pickup of document? Then say, where is this voucher? He says, we left it in Kisoro. So that meeting is gone. You can't conclude on it. So I became innovative and did exactly what Balaam is doing. So we started going to the district and meet at the district headquarters. Say, we want this. And so where are they? And by the way, it caused that scare. But somehow I was like, a time you to leave office, let other people come in. So that sort of stopped. But what he's doing is exactly what we are doing, and I think it will achieve some result. Not for prosecution purposes. That case of Mbarara, I have a little bit of very bad memories. A friend of mine was sick. She was a member of parliament, the late Honorable Bernadette Bigira. And she was admitted in Mbarara. And then the power went off. And she was on life support.
I see.
There was no generator.
Backup.
Nothing. This is a regional referral hospital. So Chief Justice Bart Katurebe went to his house, got his personal generator from his residence. Yes, to put to the hospital, to power. Can you imagine that insanity? That a regional hospital, there is no backup power, and somebody is on life support, and a private citizen then must now go pick his generator, because somehow he knew the late. Yes, so now he brought a generator to power this up, and this the sorry state of most of these up-country hospitals. So what Chris is doing is correct. I encourage him to do more. Even, James Kakoza, when he was the Minister of Health, of Jennifer, he was trying to do that sort of thing, but it never picked up. Yes. So, because really, this is about life and death. Yeah. These people we are trying to we are not trying to look after are losing their lives. And these are taxpayers. Yeah. So, what Chris did was okay. I encourage him to do more. These ministers are seated in Kampala and swinging their chairs. Maybe it's time they think of another way of doing.
Where are you looking at me? I've been in the field. I've just come to Kaptoga.
On microphone. There's a Nduhura Sam, cheeky fellow, says at Semwe Msoke, remind Honorable Abdu that what Balaam is doing now is what NTV Uganda and Daily Monitor was doing, but both are now closed.
Thank you for reminding me. What is the name again?
Nduhura Sam.
Nduhura Sam, I've got the point. Thank you very much.
So the sorry state. The sorry state of hospitals. Public hospitals.
It comes to, yes, there's the discipline, but also it boils down to funding. I think in Mbarara Hospital, projected funding, I think the budget against actual release, I think their budget is 36 billion, 37 billion, and the release is at 3.5 billion. And unfortunately for Mbarara Regional Referral Hospital, it has a very big catchment. much wider than these other hospitals. For instance, myself, who comes from Fort
No, how much was approved? Release is different. Was that man approved? The 36, and then they released the less.
No,
or this was their need.
That was their need. It's their need against. Oh no, not budget and actual release. No.
Okay.
I know where you wanted to take me, but and thanks for schooling me on that. I concede. Thank you for the knowledge. Just a bit about having legends who have been in Parliament, serving term upon terms. Mbarara Regional Referral Hospital has a very large catchment that it serves. Bushenyi, Isinjiro, Chiruhura, Kazo, Ibanda.
Great Ankole.
And Ankole is really, it's a very, very populous. Very, very popular.
So what are you saying?
No, it's bound to have an overflow. Yeah. An overflow of, just like Mulago Hospital. One of the reasons as to why Mulago Hospital is overstretched is that they even take their instances of fast what that can be managed at health center levels. Yeah. So it gets overwhelmed even by patients who can be attended at
that are not referrals.
That are not referrals. Then,
so are you saying you are understanding and it is acceptable for Mbarara to be in that sorry state that the minister found?
No, I think the other approach that we are using of this shock therapy of the Honorable Baram and Honorable Bagyo Munsi can be solved even with the technology. You can monitor absenteeism, you can monitor patient whatever capacity from remotely. You don't have to go and call the cameras and what have you for you to do that. But maybe for a cultural change, for changing management, we need this kind of shock therapy. But I must also remind our listeners and viewers, remember Ogwang, the Minister for Economic
Monitoring, yes.
He also did this thing. He traveled around the country and arrested a few, took to police stations. A number of them are still on extended bonds up to today. But none of, as Honorable Katutu said, that's one thing to administer this shock therapy and get people on their tenterhooks for them to deliver what they are supposed to deliver as a service. However, at the end of the day, how many result into prosecutions? These are reported crimes. How many of them are actually prosecuted, and how many of them are result in convictions? But more importantly, for us to have a sustainable health sector is, as Dr. Kalebu talked about, the doctor what?
Doctor-patient ratio.
Doctor-patient ratio, and in particular also the skill, the quality. Skill, retooling, reskilling. What interventions in place from government to address this? Because for the last, and let me not sound like the head of state, since 1986, our health budget has increased more than 600%. But is it increasing at the same rate and proportion as the population and the health needs of the population? That is the question that we should...
As we are about to go to Lydia.
Okay.
Yeah, finish off that sentence.
Okay, so this therapy we are getting from the Honorable Balam and the Honorable Bargiomos is good. It's good for the optics. It's also good for it's also good for the local governments to know that service delivery in this country actually happens at local government level, and yet that's where we tend to concentrate on graft and corruption at the top, at the central, and then we neglect the corruption that is at the what? Local governments. That's why it is most pronounced. The kind of cartels, the kind of clientelism.
But there's another minister also involved. I don't know whether you've watched Jeno Tumukunde. Is more or less also gone in a very unorthodox way.
And believe me, Tumukunde will...
About getting passports.
Tumukunde will have some prisoners he will take.
Yes.
Honorable Anyoto, on the state of hospital.
You've been giving an example of Mbarara Referral Hospital.
Because that's what the minister quoted.
Why don't you listen? Mbarara, unlike other regional hospitals, it has a teaching hospital. the University of Science and Technology uses the referral hospital as one of its teaching facilities. So that also tells you a story about a teaching hospital. It's more serious than you think, because we have students in Mbarara Science and Technology who study and work using the facility of Mbarara Referral Regional Hospital. Now, what's happening, and I don't know that you have noticed, we now have many teaching hospitals, teaching schools, teaching medical schools beyond, I think there are about 54 chartered universities, and most of them are now, that's why we even have issues of interns, because they are more beyond the teaching, the medical schools. These are when people go for medical support, they start asking, where is this one trained from? That's very dangerous for health services. So beyond what Dr. Chris and his people must do, there are questions about quality, and it's a very serious matter. We need to draw bigger cameras on the quality of teaching and service delivery in the white jackets, and I agree that you can go to a hospital, because if we woke up one morning and said, let's talk about being clean and tidy, that's already preventive. You'll have so many people out of hospital by just a campaign on hygiene and personal
and you have care workers who are unhygienic
beyond the infections. Because how do people get infections? It's because of contact with poor hygiene methods. So that's a big issue. But for the issue of the 12th Parliament and this term, I think this is a good beginning, so that you begin from where did you find the sector, so that you begin measuring your accountability. If your sector, like my case, if your sector has district service commissions which are not operational, recruitment money goes back to the consolidated fund, there is no recruitment, we should begin by putting a cross here and say, how did we find a sector? How do you want to leave the sector? And Katuntu, I was just thinking that when decentralization happened, we've not given it chance to review whether it's working for people or not working for people. In the few weeks I've been in that sector where I work, there are a lot of complaints about engineers. They are saying the districts are not finding the rightful engineers to recruit. The requirements and qualifications are far beyond what you find those who come on the short list. To be an engineer of a district, you must also qualify to be a civil engineer, but most important, to have been having a certified qualification. So you must be approved by the board of engineers. They have an association. So now, if you don't have a certification of being an engineer, you could not qualify to be a district engineer. There are many districts that do not have those qualifications.
Just a quick pause, Abdul, and we go for a break. We'll come back from the break. Lydia, just conclude on hospitals. I want to go to
okay, let me conclude on mine is a big picture policy issue on decentralization. When there were challenges about cows, Katuntu, you remember that you withdrew, there was an amendment and cows were withdrawn from local government back to the center. Now there is a debate whether we should withdraw medical officers and also engineers back to the center. So
District Service Commission is what to address.
Yes. So those are some of the challenges.
We need a district service commission for those senior officers.
So those critical sectors that are highly professional, because even the districts cannot afford to pay them. If you look at the wage bill, a properly qualified certified engineer cannot be paid by a district. And also there are many districts that don't have such people. Some would, like for medical, there's a district that wanted to employ a vet doctor for a DHO, a district health. They were saying that after all, this is our son, and if he can manage animals, why what about human beings? So there are many challenges in No, it was not
Somewhere.
But you know, now I'm a minister for Uganda, so there are things on my desk. So I think that we need to revisit the human resource competencies in critical sectors vis-a-vis center and district service commissions and service delivery.
Okay.
And this is something that we should do as an emergency. If we are talking about real service delivery, I do not see, even for road for construction, that we have qualified certified engineers seated in the list. There are some other qualifications, but they are not certified engineers as per the board regulations. Yes.
Derek Wandera, we just get Derek to conclude it since he started it without ministerial perspective. The Moses Nkutu in Kampala says, Oscar, to put it straight, Busoga sub-region is more populated than Ankole. He was kind of responding to Edgar Tabangi.
No, I wasn't talking of relative.
And Dr. Buku, I've been waiting for his message.
Dr. Buku.
And it came. I've been waiting for his message.
Looks like it even came too late.
Let us listen.
It came too late.
There is one person you should invite here.
I always invite him. He says, very informative UVRI session. They have achieved a lot. Uganda public health system will become robust when senior public servants are conscripted to use these facilities, right from the high and mighty as well as local government leaders. Short of that, the dual system of senior public servants using taxpayers' money to travel for medical health, we will not improve. So,
I think Dr. Book should not get away with this one. One, he should first of all, what he's saying is correct, but he should also look introspectively. There is a problem amongst the professionals that he should also recognize. What's saying is correct, but he should also recognize that there is internally a big problem.
But even I must add
Abdul,
that when it comes to disciplining,
our friend of Dr. Ndugu says Ndugu should look. What he's saying is correct, wrong, but also he's right. That's what you're saying. But Edgar, close it out. I want us to go to electricity, so you'll go first.
I'll go first on what?
On electricity.
On electricity. Now,
let Derek conclude on hospitals.
Yeah, on hospitals, I think what we are seeing is something that has been here. That as journalists, we've been very big crusaders in making sure that these doctors, doctors attend to their patients. The state of health system in this country changes for the better, and I think with the likes of Minister Chris Wariomunsi, Balam, and that kind of shrewdness that they're bringing, of course, like Abdul says, probably they're not going to achieve the legal and prosecution, but there's going to be alertness, which is very good. We have to have somewhere we start from. But again, like we've all said, I think there's a level of professionalism that needs to be observed when it comes to our doctors, medical doctors. Even the way they handle us as patients. You go to a hospital and you are lambasted for nothing, and yet you're a patient. So that also,
you need to meet good doctors. I don't know of those ones.
If you went to a private
Oscar, you
facility,
never go to a public hospital.
If you went to a private one, you will certainly will never meet them. But go to a public health facility, you will just it's sickening. Okay. So I think the Honorable Chris.
Yeah, but not that there are no good doctors there. There are very, very good.
Yeah, there are certainly some of them, but the majority you find are either frustrated
and interns
overworked or something like that, and which is something that needs intervention at that level.
Edgar, start on our last topic. Are you happy? I'll ask the same question. I've tried to get UEDCL here, and they say they're coming. I managed to get a energy activist, Dickens. Kamgisha, yes, but he's had to travel this morning. And so he was going to help us digest or point out things. But if we start on a discussion, perhaps we shall get them to come here. You've been unhappy with UEDCL in recent times. Why?
It's not just UEDCL, the entire power sector. And
For now, let's concentrate on UEDCR.
The entire power sector. And I'd like to draw parallels first with I like to go into that. Republic of Ghana. When Uganda was starting out on its economic reforms, we undertook them at the same time with Ghana, and were ranked as partners, as peers in 1991. We were ranked as peers, and we undertook the same reforms in currency and what have you, adopting the structural adjustment policies, the whatever, fully. Now, as it were, Ghana went past us. We stagnated at some point, and the electricity sector is one of the areas where I think they beat us. They achieved high rural electrification, connectivity. In Uganda, connectivity still stagnates between 26 and 32%. Connectivity. That is overall in the country, including the rural areas. In the urban areas, it's just over 50%. Connectivity to the national grid. But remember, there are also mini grids, and there are solar, whatever, and wind power.
You're even just talking about connectivity, not even provision, not supply.
Not supply. Yeah. Now I'm coming now to the supply side. We generation capacity is 2,200 megawatts. Our peak demand is between 1,450, 1,500 megawatts at peak. Our tariffs are between 15 and 18 cents per kilowatt hour, which is lower than Kenya. Kenya is at, I think, 24 to 27, and Tanzania is just about the same. Ghana is just about the same. Now, we have excess power that is not being consumed, and yet our peak demand is 1450, and we don't have as much connectivity as should be having. So there's a disjuncture between what is being produced and actual demand. Now, my gut feeling is that we have what we call constrained demand. We are demanding what is being distributed, not we are demanding what is available. And why aren't we able to absorb all this and distribute it? We have dilapidated infrastructure. We have high loss of energy in transmission. I think it had been capped by the Auditor General at 25%, but there was an amendment that was introduced when Umeme was still in charge. I think they capped it at 38% as compensatable loss, without clearance from the Attorney General and Solicitor General. You know all that. But more importantly, there was an inquiry that was commissioned by Salim Saleh, and I think it was chaired by Bikumune, the now deceased, the former deputy governor of Bank of Uganda, an economist, a very fine economist. They did an inquiry and were able to establish where exactly the problem is. And I think, in my opinion, we have to make a decision as to whether investing in reinvigorating the infrastructure, the distribution infrastructure, and reducing commercial loss, as well as upgrading, is an OPEX or a CAPEX issue. Now, when you make it a CAPEX issue, it delays operations, it postpones interventions, because when you take it to CAPEX, that involves, I think, borrowing money from external sources. There may be local or external, and that involves parliament and what have you. Now, if you make it an OPEX issue, that it is an operational expenditure rather than futuristic, then the interventions will be quicker. For instance, Kampala alone, if you look at Kampala alone, we need a minimum of 1,000 what are they called? Step down transformers. 1,000 for us to stabilize and have electricity supplied to all households within Greater Kampala. 1,000 alone in Kampala. So now, if you're going to make that a CAPEX issue, it's not going to be an immediate concern. It will be postponed. So critically, we have to wake up. We have to wake up. And electricity in other parts of the world is considered as a human right because it eases, it makes life easier. It makes life easier. You've heard about electricity not being available.
About middle income and all that industry and so on.
But really, if we're to have all that electricity consumed, and the commercial loss in transmission is brought down, and investment in infrastructure, the tariffs are even likely to fall to half of what we are paying. And at the GDP, at the GDP level of Uganda, we should be able to afford electricity in nearly 3/4 of the households of Uganda.
On electricity. Since the move to UEDCL.
You see, Oscar, Edgar is speaking really like an engineer from UEDCL.
That's a fair comment.
Well, yes, you because the people we are speaking to, they want power and affordable power, basically. So we need to find out where is the problem. There is a little power being consumed, but there is a greater demand, and also the price of that power. So let us now segment it. We start. There are 3 phases. One, there is generation, power generation. Do we generate enough power to satisfy our market? Yes, we do. Actually, generate more power than even what the market would need. That's number one. Number 2, there is now transmission. That power you generate, we have to transmit it to where it is going to be distributed. That process involves what he's talking about, which we call technical and non-technical losses along. So that the power which eventually reaches distribution is less than that which has been generated, is less than that which has been transmitted. So it is now less power. What do you have to do? You must now address the technical and non-technical losses at transmission level. Then you have enough power to distribute. Then even at distribution level, what happens? That's when you now bring in the
Step-down generator.
The infrastructure and so on of step-down generators and transformers and so on. 2, when you talk about power is not free. We pay for power. So where is the problem? Because nobody wants free power. Power is being sold. And there's somebody who says, give me power, and I consume and I give you money. It's business. So there's that level also, that why isn't power reaching to a place where it should be bought by the consumer, the ultimate Edgar, who is the what? Who is the consumer, and he needs it and he has money. So if you are to, what we have to do, first of all, for fair prices, you need to invest in infrastructure so that power transmitted is not lost. And then 2, at distribution level, you need also to invest money at distribution level. And over years, we had this contract with the Umeme. You know what happened. I don't want to go into it.
You are very uncomfortable.
I don't want to go to it. Then 2, we have got these people who came and took over the successor in title of Umeme, UEDCL, and we gave them money. By the way, we gave them a lot of money, and we even borrowed money for purposes of improving their efficiency. So there is something which the managers of power should address. And they don't have to cause us this sort of big debate and even a crisis that even now we are still talking about load shedding. Right. Unnecessary. Because we have given them money to invest. Yeah. So, Edgar, yes.
The cost of work.
Yes, it is true there has been losses. and then the public has come in to pay for the loss. That is what is painful, because one of the reasons
goes higher.
one of the reasons why the tariff is high for me, who is an ultimate consumer and faithful that I pay my bills, I now must pay for the loss of the losses. So these are the things which should be addressed. For me, who is the consumer? About power generated, this, yes, but we want
electricity,
power, and we want affordable power. And then too, there's the other arm where government is saying, if we need to develop this country, then you need power for commercial purposes, industrialization and so on. That's why we've invested so much in the generation, because you don't put up an industry, then you look for power. Industries will come where there is already power generated.
But the shocker is, Honorable Katuntu, we are having actually deindustrialization. Some industries are choosing to take their factories to Kenya. I'm not going to mention names because,
maybe. Derek, Abdul accused Edgar here of being sounding like a UEDCL engineer.
Yes.
He also started like one. Like a government engineer.
No, actually, it was a more of a compliment.
But his conclusion has been okay. And I'll tell you, on our village group in Chigo, message. This was Thursday. Yesterday there was no message regarding electricity, which is kind of a miracle, because every day we get messages. So the first supervisor said, due to some works at our substation, we are going to receive intermittent supply for about 20 minutes. Switch off sensitive equipment. Then the manager herself wrote, dear customers, kindly be advised that you may experience intermittent power supply for the next 30 minutes as we conduct essential testing at the substation. We apologize for the inconvenience.
But that is a good interruption.
Your
substation is being
I'm reading the positive ones,
but that is the best.
That is the best.
Because they are just improving,
They can say 30 minutes and it's 1 hour or 2 hours. Then people are saying, for us, we have not received any. We've overnight. These are the big problems. So, and we know that what Abdu and Edgar are talking about, those are the big money people. But we, the local, we are the ones that make the most noise. The derricks.
Yeah, because you don't know about it's generated.
No, we want to switch on the light and it works. We want to switch on your computer at work and it works.
The cost of switching on is what I and Abdu are addressing.
The energy sector in this country is suffering.
Let's stick with UEDCL.
Yeah. you want to sacrifice. You want to criticize UEDCL in isolation. But you see, it's a whole chain. There is UEDCL, there is UETCL, there is UEGCL, and ERA, which is the regulator. Which is
Omega was there. You see, they finished. Now we have UEDCL. So
and
what's your take?
There are some residual issues.
They don't work in isolation, and that's what I'm trying to say. Because for them to distribute, there has to be transmission and
power is given to them.
Yes.
To distribute.
So probably we need to examine how power is given to them, how much power is given to them.
Derek, you're the journalist here. Are you happy?
But the generation has no issues.
I am. No. I have
happier with.
I have my own reservations and complaints.
With Umeme?
The whole of last week, for instance, we used to have. We could have power from 6 p.m. to 6 a.m. Then it goes up to 5 p.m. So you don't have power
during work hours.
Yeah, during work hours. No. At my area of residence.
Because if it was automatic, it could have been another.
Now, why are we talking about monitor? Where I have not been for now 1 month. I don't know how it looks like.
So
I don't know. So I think these are systemic issues that need to be addressed, not just at UEDCL, but at the whole chain of things.
So we forgive them.
2 months ago, that top leaders within the UEDCL were terminated. Their contracts were terminated. Some of them sent on forced leave. And I know some of them have actually run to court, complaining about the manner within which they were dismissed. It is systemic in the way that you probably want to look at the management and administration of UEDCL. and the management is telling you, yes, we have problems, but the problems are not coming from us. They are systemic. We look at UDCL and we expect them to have, an angel that is living amongst demons. The whole country has problems. We don't expect better from UDCL. I mean, they are just doing what they can. But let's fix the systemic issues, and I know for sure that we will be there where we expect them to be. They have complained about problems that they inherited from Umeme. We have given them now 1.5 years, 1.5 years to solve those problems, and yet they seem to be just coming up. And we need to go down the entire chain and see where is the brokenness.
Yeah.
But if we don't do that and address only UEDCL, probably we're dealing with the symptom and not the cause.
Yeah. Honorable Lydia Anyoto, are you happier with UEDCL than with Umeme that went?
Now, the UEDCL has specialized in the distribution of notices of where they have power shut down. And the latest for...
They have specialized in distributing notices
about power shutdown. The latest is in Mbale City. And for this weekend, beginning 16th, 17th of July, they have told us in Mbale City, Palisa Road, Chibuku, Butebo, we shall have a power shutdown. And we have been advised to switch off our gadgets when even there is the last match of World Cup, that in Mbale people will switch off their gadgets until they will let us know when the power will be restored. That any inconveniences caused a highly regretted management. So you are telling me to comment.
You have commented enough.
They didn't give the time when they expect.
They are not sure even when the thing will end.
Sure.
And everybody was geared up. I come from Mbale City. Everybody would like to sit on their tellies tonight to watch the World Cup. Maybe they will use generators.
The bit about it, the unbundling was supervised by one of your own.
Yeah.
So, Lydia.
Engineer Muloni.
So you're concluding.
So they were given 100 days of delivery to see how they can perform since the transition. But I think they have excelled in public notices on where they are shutting up. Interestingly, today they've shut up in the city of Mbale and a neighboring district. Yes, so shut down. Sorry. Yeah. So that's where we are now. So what else can I say if we are in darkness? And we have been campaigning for small-scale industries. People are doing their popcorn. Those who are milling. We have an industrial park. We have industrial division there. For us, we are small landholders. The best we can do are those small cottages that depend on electricity. Right. So if you are telling me that you are shutting down, it means that there will be no business for the whole weekend. People are poor, so who is going to back up? And there has been drought. So people are depending on the small businesses in town where there is power. And the power is a big security issue. The moment there is darkness, you will not avoid...
You have insecurity.
Insecurity coming. They will come.
And there are very many small business people that rely on electricity, like those people with fridges.
For us, our small scale industry mainly is on even whether it's a saloon, whether it's a milling of maize, a maize mill or whatever.
There was a time
whether it
the
is
substation at is it Kalitusi
even
Road,
in the industrial park.
Is it Kalitusi Road? There's a time the substation.
The welders, the welders in the garage. You have a big garage in Mbale. They actually you are big fan.
Yeah.
So if there is no power, I don't know how they are listening to you.
Sometimes I go to the same salon as Abdul Katonda. I rarely, because his is very expensive.
Yeah.
But again, I call them.
So it's a big, for us, it's a big.
Electricity? They say, no, you stay away, no electricity.
It is a big economic issue.
Explain why you've not had a haircut.
There's
another issue that we need to address. The procurement.
Barrow, thank you so much.
The procurement procedures.
We are leaving. Derek Wandera, thank you so much for your contribution. Honorable Lydia Anyoto, my mother has said that you look very smart in your... my mother has said you look very smart in Gomesi. Star Cafe, thank you so much for powering the gang. And Professor Kalebu has wowed our audiences. We thank you. You can follow us on Capital FM. We have Same way I'm Soke at Twitter. Then we have NBS. Then we have Capital FM Continue.